morning, everyone. Today I will speak about the risk stratification of biometric factor in early onset primary and closure disease. Myself, Dr. Suresh YADAV from the RP Center, AIOS, New Delhi. As we all know, adult onset primary angle closure glaucoma is the leading cause of irreversible blindness. However, there is very limited study on early onset primary angle closure disease. That doesn't have very much of known studies. Since there was very limited study on early onset primary and closure disease, and mostly I'll focus on the etiology of the disease only, there is only one study which has evaluated some factors of the biometric in the early onset primary and closure glaucoma. So since there was no study that has been looked into the factor that lead to the development of glaucoma in eye with early onset primary angle closure suspect and eye with early onset primary angle closure. So we aim to identify the potential biometric risk factor that could seen as developing angle closure glaucoma in the eye with early onset primary angle closure suspect. In this cross-sectional observational study, we include the patient aged between 20 to 40 years diagnosed with the primary angle closure disease, and we exclude the patient with the prior laser peripheral iodotomy, history of ocular trauma or surgery. We also exclude the cases with the secondary angle closure and eyes those have non-ophthalmos and asperophakia. A detailed ophthalmic evaluation was carried out along with the gonioscopic evaluation to all the patients. We also did ultrasound biomicroscopy along with the STAR 360 analysis to look into the mechanism involved. So mechanism of angle closure was primarily relative pupillary block, pseudoplateau iris configuration, plateau iris configuration, and an exaggerated lens bolt. Similar to ICGO classification proposed for the adult onset primary angle closure disease, we opt a similar criteria and classify our patient into early onset primary angle closure suspect, early onset primary angle closure, and early onset primary angle closure glaucoma groups. Coming to the result, the mechanism of angle closure was predominated by non-pupillary block mechanism, which includes the pseudoplateau iris configuration and plateau iris configuration. In the eyes with the early onset primary angle closure disease, this is compared to the relative block, relative pupillary block and exaggerated lens bolt. So we didn't find any significant change in the refractive status among the subgroup of the eyes. While comparing the biometric and anterior segment OCT parameter of eye of different stages, we found anterior chamber depth was least in the eye with early onset primary angle closure glaucoma and significant with the shorter axial length in this group of the eye. Early onset primary angle closure glaucoma has the thicker lens thickness and so the higher lens bolt along with the lower relative lens position. So all the mechanisms which lead to develop angle closure were more pronounced in the eyes with the early onset primary angle closure glaucoma groups. So coming to the main aim of this study to identify the potential risk factor, we found shallow anterior chamber depth as the most robust predictor for early onset primary angle closure glaucoma, followed by the lens thickness and lens bolt. So despite of some limitation, this study represents the milestone in the research of early onset primary angle closure disease by having the highest number of eyes study and also pioneering in identifying the potential biometric risk factor for developing angle closure glaucoma in the eye with early onset primary angle closure disease. As stated earlier, non-pupillary block mechanism is the most common cause of angle closure glaucoma in the early onset primary angle closure disease. A shallow anterior chamber depth identifies the most robust predictor for early onset primary angle closure glaucoma, followed by the lens thickness and lens bolt. So we can conclude as a thicker and more anteriorly placed crystalline lens was the key anatomical factor associated with the shallow anterior chamber depth, and that could lead to rapid development of glaucomatous optic neuropathy in the eye with early onset primary angle closure disease. Thank you.
You said it's a strong predictor of glaucoma. See, a cross-sectional study cannot be a strong predictor of glaucoma. You've done a cross-sectional study, not a longitudinal study.
This was the limitation of our study. The longitudinal should be the ideal setting, but this can lead to...
It's not ideal setting, except for no diagnosing or saying this is a risk factor, you have to do a longitudinal study. A cross-section study is not capable of that.
Yes, sir, that is our limitation of this study, but that could lead to stretch the year of the study.
Just tell me, how did you diagnose, how did you define early onset? What was the cutoff for early onset?
Early onset is defined as the onset before the age of, before the 40 years.
40.